Let's start with leg swings. I want you to stand with your left hand to the wall, getting ready to take weight into the left leg. So not using any muscle here, just swinging the leg front to back using momentum. 5 to 10 times. 3, 2, 1. Now turn to face the wall and use it to support your balance. You're going to turn the toes in, and then you're going to turn the toes out. Again, just using momentum. Whatever your range of motion is perfectly fine. Doesn't need to be super high. Turn in, turn out. Just breaking up some of that space around the hip, some of the connective tissue, so you can move. Now I want you to come onto the left leg. Make sure that the knee is a little bit bent so that you have some space to move, so that your knee isn't locked out, so you don't hyperextend the back of the knee. So with the left knee a little bit bent, I want you to take the toes towards the wall, chest up, and then drop the chest. The leg swings back. Again, just using momentum. I'm not lifting my leg, but you should be feeling this in the standing hamstring. Up and back, up and back, up and back. Okay, let's do the other side. So again, just using the wall to support you. Standing on your right leg, swinging the outside leg front to back. No muscular effort, just momentum. Turning to face the wall. Left toes in, left toes out, swing. This is really helpful if you wake up with a lot of stiffness in the morning, just to, again, break up. You have this big piece of tissue. It's basically like saran wrap that goes underneath of the skin, and it wraps all of the muscles in the joints. So this just helps break some of that up and give you some more space. Lastly, standing on the right leg, give yourself a little bit of a bend in the supporting leg, or in the standing leg. Toes and chest up, toes and chest back, up, back. If there's some popping in the hip, as long as it's not painful, it's perfectly healthy, it's perfectly normal. Mine are super noisy, so. Okay, make your way all the way up to standing. Now, we're going to be doing some totally switching the direction of the action. Now we're going to be super, super muscly and super intentional with our movement. So standing on the left leg, what I'd like you to do is to face the wall, use the wall for support. Start by lifting the knee up into your chest. Notice if the hip starts to travel to the outside. Notice how I'm trying to shift my center of gravity. So I'm trying to counterbalance here. Roll the hip down. You want the thigh bone to be moving in isolation throughout this whole exercise here. Now, you can take your hand outside of your knee just to help you understand the direction. I'm going to be pushing my knee straight out to the side. Keep your butt pushing forward towards the wall. And again, notice if anything crazy is happening with the hip. From here, turn the knee inside, foot outside, take it all the way behind you. Now from here, try to pull the hamstring and the heel all the way up to the ceiling as much as you can. Again, notice if the thigh bone starts to roll out, keep everything turned in and pull up. Let's do a couple more rounds. Hip flexion, lifting up, external rotation, take the knee to the outside, internal rotation, take it behind you, extension. So the front of the hip should feel like it's getting longer here. Thigh bone up, leg towards your chest, turn the knee out, turn the knee in and behind you. Try to pull the leg up, pull the heel towards the ceiling. 2 more. up, out, in, up. Last one. Up, out, in, up. You can use your hand at the front of the hip to encourage the hip to push forward, and release. Second leg. Start by bringing the knee up, and again, just force that compensation so you know when you're going out of position, and then you know how to correct it. So drop the hip down. You can take the hand to the top of the thigh to encourage the thigh bone to pull straight up. Take the fingertips outside of the knee, and the knee is pushing the hand out. External rotation. You can take it inside of the knee or just start to turn. So the knee is in, heel is out. Take it behind you. Keep that internal rotation, extension. Push your hip bone forward. Again, up, out, in, extend the hip, up, out, external rotation, internal rotation, extend the hip, 2 more. Flexion, bring the thigh towards your chest, turn it out, external rotation, in, up. Pull your heel up towards the ceiling. Last one. Up, out, in, extend, push your hip bone into your fingertips towards the wall, and release. So now turn with your left hand to the wall, standing on we're going to be balancing on our left leg here. I want you to take a look at the foot. The tendency, our neutral position is with the feet kind of at a 45-degree angle. What I want you to do, if you're using a mat or if you have some sort of indication on the floor, like some tiles or some pattern, make sure that the baby toe side of the foot is lined up with some landmark here, so that the side of the foot is straight, the foot will look a little bit pigeon-toed. From here, you're welcome to hold the knee or to hold the big toe. I'm just going to stay here for these exercises. Adjust. Drop your hip. Turn the knee slightly out. Okay? 5 breaths here. You can, again, give downward pressure if you feel pretty stable here. Or you can use the hand to keep pulling the knee up. 3. Keep the toes active. Keep pulling the toes towards your shin. 2. 1. Take the knee to the outside. 5. Again, notice if your hip is creeping behind you. Drop it down. 4. 3. If you feel stable, you're welcome to take the second hand to the hip. 2. 1. Inhale, bring it back to the front. Practice the balance. Keep the leg here or kick it to the front. 5. This is where the hip really wants to travel. Drop it down. 4. See if you can turn the knee out just a little bit. 3, 2, 1. Release the leg. Second side. So I'm going to do this without balance just so I can stay facing forward. But again, if you need the support of the wall, just flip to the other side. Line up the baby toe so that it's straight with the foot slightly pigeon-toed. Kick the hip bone forward. No bend in the hip, no bend in the knee. Bring the left leg up to you. So either giving active resistance here or using the hand to help pull. 1, toes up. 2, adjust. Notice that hip starts to cock up like this. Roll it down. 3, 2, 1. Open the knee to the outside. 5, 4, keep your standing leg straight. Keep pulling the kneecap up. Keep pushing the hip. 2, 1. Inhale, back to the front. Try to balance without the wall if possible. 5. To your capacity, extend the leg. Notice if you're leaning back, belly button towards the thigh. 4, 3. Keep the standing leg straight, kneecap up. 2. 1. Inhale, exhale.